Lately, CBD products have been popping up all over the place. Yet many people do not know what CBD actually is and how it differentiates from THC and other constituents within the cannabis plant. So let's talk about it. Hey everybody, it's Dr. David. Hope that you're having a great day. As many of you know, I am a holistic pediatrician. I have been using herbs in my medical practice for well over 25 years. And early on in my career, pretty early on, is when I started to learn about CBD and the wonderful aspects of it, and also how it differentiates from marijuana, predominantly because of the fact that there's not an intoxication. Now, my detailed more relationship with this goes back to about 2012. And at that point, I had never heard of it before. And I was doing a follow up appointment with the family. There was this little boy who there was a birth injury. The brain damage had happened. It was a very difficult situation. I'm helping the parents through this whole process of theirs and what they're going through with their son. And rightly so. The parents, especially the father, was a pretty disgruntled individual, especially because it did seem as if there was a delay at the hospital, which led to the injury in the first place, which was really, really unfortunate. And so I'm guessing it was like maybe the fourth, fifth visit, and they come into the room with their son, and I know, and the dad sits down, and he just has this like chill to him, like I had never seen him before, kind of just like a nice little passive smile on his face, and but it was different enough that I literally said to his wife, what's with him over here, and she said he started taking CBD. And at that point, I'm like, I don't know what that is. And she says, well, it's a non-intoxicating cannabinoid that, from the hemp plant that has a lot of benefits when it comes to things like depression and anxiety. And he was a health food store owner at the time. And he had brought this company in that he was learning about, that he was very satisfied because of the cleanliness of the product, the purity of the product. And so that's what kind of started me on my path. And around that same time, families of children with autism, who of course were always the people who are looking for the next thing to help their kid. Um, and they started asking me about it. And so I started learning about the product. As many of you know, herbs, when it comes to kids, certainly not well studied. And just like what I had done a few years back during my days at Tampa General, once I knew that there was a safe product out there, I had to figure out how much to give, how often, how many drops of a tincture to give, etc. But over time, we figured it out by starting off very low, going slow, making incremental gains, slow increases until we get a beneficial response or no response whatsoever. Okay, now what we're going to talk more about are not just with the different how this is different from other cannabinoids. I'm going to also compare it to some other over-the-counter companies. One that I use in particular called Miriam's Hope, but also Epidiolex, which is the pharmaceutical grade version of it that is not my favorite, which I'll explain to why. And we'll also talk about, what safe dosing may be, and or can one even hurt themselves with CBD. Okay. So as far as what CBD itself is, okay, so it is a cannabinoid. So within marijuana, with medical marijuana, within hemp plants, there are two main constituencies. There are cannabinoids, things like THC, CBD, some of the others that I've talked about on this channel that I'm not going to go into. And then there are also what are called terpenes, which are the other ingredients that have different effects. Some have more energy providing or calming effects, or anti-inflammatory effects as well. And again, we won't get too far into those terpenes on this particular broadcast either. But in terms of the things that I've seen it be helpful for, probably the most helpful thing is, but for things like anxiety and depression, just a calming of the nerves, allowing people for to be able to be more calm in their life, to be able to move on, similar to this individual I was talking about. Okay, but it's probably most studied when it comes to anti seizures. Okay, it's been well understood about that for a long time, but it can help with pain and inflammation. It can help improve sleep, both getting to sleep as well as staying asleep. It can very much help with nausea, especially when people, whether they have a gastroenteritis, but also people who may have be taking chemotherapy and other types of treatments such as that. It can improve attention and focus for individuals. It can also improve negative behaviors. I've seen a lot of kids, for instance, on the spectrum, that their behaviors improve. They may not be as irritable. They may be more amenable, more compliant for things. And it does lower inflammation in and of itself. Okay. So now, as far as just some also further clarification, both marijuana as well as hemp, they are both actually cannabis sativa plants. They're cousins of each other. Obviously, one has the intoxicating effect of THC, the other one is predominantly CBD. But they are still considered cannabis sativa. And I know people talk about sativa as a particular type, but that's not the type we're talking about. They're all really considered some sativas. Now, over time, there has been medical marijuana that has been cultivated to bring up the CBD value and the THC amount. But of course, hemp in and of itself is just naturally that way. Now, as far as when taken together, another very interesting thing. CBD can lower, potentially even completely stop the intoxicating effects of THC, while the other benefits of THC, which are very similar to what I had listed for the CBD, can be used. So if CBD alone isn't bringing enough of effect, and THC, but maybe it causes a person to feel high, to have an intoxicating effect, have it affect their cognitive function. CBD often can pull that part back and can make a person more functional. And that's obviously super duper important. Now, of course, that's really important when it comes to treating kids, because certainly we don't want kids to be getting high. We want kids to get the benefits of it. Also, the reason why I'll use CBD along with THC if I have to use THC in my medical cannabis patients, because again, we want the benefits to be there without the negativity. Okay. Now, in addition to that, one can inhale CBD. Most people don't think of it, but they do make it in vaporized form. CBD, they do actually make flower. They make buds that are CBD and non-THC, so it kind of looks like it smells like it. You can do the same things with it, but you don't get high from it. Okay. And I've also seen, and CBD can even be an antidote if somebody overdoses on THC. I've seen this happen before with a patient. I was able to give them inhaled a vape cartridge of CBD only. This was somebody who was pretty much stuporous, really couldn't answer questions, couldn't even open her eyes. She was comfortable and had a smile on her face, but that was about it from a function perspective. And inhaling the CBD reversed this in about 10 minutes into starting to do an inhalation therapy with her. She did come out of it, so that was pretty interesting and cool to see. Okay, now in terms of how it works itself, so we have what's in our body is what's called the endocannabinoid system. All vertebrates and many non-vertebrates have it. The job of the endocannabinoid system is to maintain balance, homeostasis. I know I've used this analogy before. Our body makes two endocannabinoids, 2-AG and anatomide. And what that does is when one cell, and this is particularly with like pain and nerve cells or inflammatory cells, if the first cell is firing over here and making more inflammation, more pain, this cell sends an endocannabinoid back to this cell, basically saying, chill out. The analogy that I've used is kind of like when we take our kids bowling. Our kids put up the little the rails. If the person goes to the left, to the right, homeostasis, balance, it brings it back into the middle. Okay. What CBD does is it raises those bars, allowing the cannabinoids to stick around longer. One of the primary functions of CBD is it slows down the breakdown of our natural endocannabinoids, allowing them to stick around longer to do their effect. Now, it doesn't appear as if the CBD directly works on the endocannabinoid receptors, which are called CB1 and CB2. It's more of an indirect. It may also work on some other receptors that we're not aware about yet. They could be within the endocannabinoid system or even without it. But one of the things that it also does is it can interfere and interact with serotonin receptors, and in particular one called 5-HT1A receptor. As you may know, serotonin is what helps boost people's moods. Medication that increase serotonin are all the medicines that are used for depression and anxiety. Now, also, CBD's interaction with these receptors themselves may also be why It helps with anxiety, depression, etc. Okay. Now, in addition to this, there is a pharmaceutical treatment called Epidiolex. This is the one that garnered all of the attention about a decade ago because it was found that it treated seizures, and the FDA approved it in particular for two genetic conditions, but we're allowed to use it for other epileptic conditions as well. Now, it's a pure CBD product in that it doesn't contain any terpenes, any other cannabinoids. It's an isolate of CBD. Okay. Now, in and of itself, I'm not a huge fan because it also has some artificial, some sucralose in it. Now, the products that I have been really finding the most interest in my own self, and the ones that I mostly use, is a product from a company called Miriam's Hope. I know I've talked about it before, and the reason why I particularly like Miriam's Hope is several. Number one, they taste better than most. They can a lot of hemp derived products have a very earthy, grassy kind of taste to it. But this one is made in olive oil, which is also really good because that's really good from a food perspective, as opposed to some will other use MCT oils or other types of oils. But it's an olive oil base, and they may add some essential vanilla or essential orange flavor to it in order to give it a nice, pleasant taste to it. I like about it also with the Miriam soap because they have different strengths, and I typically will use ones that are like 50 milligrams, even 100, 200 milligrams per one dropper. The Epidiolex that I was talking about before, that's 100 milligrams per dropper. So this is an over-counter product that actually has the same strength as the prescription, which that doesn't usually happen with over-the-counter products. One of the other things that I really, really appreciated is they do third-party independent testing, and every company should do this. I don't know why they don't, and put it on their website for accuracy. If it says that there is 50 milligrams per dropper of CBD, maybe it has some minor cannabinoids, terpenes, it tells you exactly what's in there, but it also tells you what's not. Things like pesticides, heavy metals, molds, mycotoxins, other types of substances that you can't pronounce. But every single batch is checked for to make sure that there is no impurities in there. So we have both the accuracy as well as the impurities. Every batch, they will not sell it. The product will not sell it. Now, again, not to say there's not other good companies on the market that does this, but I really appreciate this. But the thing that really also stands apart with the CBD products from Miriam's Hope is that they have these different terpene boosts. So the terpenes, as I said, when people talk about different strains when it comes to medical cannabis, indigos, sativas, but there's lots of indigos, lots of sativas. And the thing that mostly differentiates those are the terpenes. So with the Miriam's products, they have these different terpene boosts: an energy boost, a focus boost, a pain and inflammation boost, a calm boost, and those have different terpene profiles based upon what the effective. I know people who will use a more energy and focus type of blend during the daytime. They'll switch over to more of a calm blend at night, and you can do that with the different products. And they have all of the other cannabinoids that are there as well, which is, again, really, I just think that their product line just really, I know of no better and very few equal it. Let's put it that way. Okay. Now, as far as the going back to the Epidiolex, one of the benefits, though, is that if a person does have epilepsy, insurance can pay for it, and it's not cheap. So that may be a reason why someone says, hey, despite the fact that it does have the artificial sweetener in it and it doesn't have the other constituents, hey, I can afford it. And let's face it, if you can afford it, you don't want to put your kid on seizure medication. Lots of side effects there. And more importantly, it works. Isn't that what we're looking for? So, of course it is. So, but because of the other things as well, I'll typically use the other products that are out there just because, to me, it makes more sense. And it's more natural, kind of closer to the way that the Mother Nature gave us the plant in the first place. Okay. Now, in terms of what kinds of dosing that can be used, because you'll see people they'll have, I'll take 10 milligrams of CBD, 20 milligrams of CBD. With the Epidiolex itself, okay, the for a 50-pound kid, the FDA has said they can take up to 450 milligrams per day, which is huge. I don't think I've ever given anybody that number of milligrams, but it's nice to know that the FDA in their assessment has said that this is a safe amount. Okay. So, and of course that really says, hey, they believe that it's safe. So overall, there's some interesting facts about CBD, things that you may not have known about. If you have any comments, let us know if you've had any experience with CBD, what products, what companies have worked for you. Always good for me to learn about more, and our listeners and our viewers can see what you posted there as well. All right, have a nice day.